Good morning. We are on page number 13, the package we started yesterday, and it is a lot of information about the safety and other thing. It says on the top, safe and effective care environment on the first page, but I'm on page number 13. Page number 13 is a lot of psychosocial needs. It says psychological. Psychological means mental health. So there may be questions on mental health, and you guys, you must know some of your patients with mental health problem. So 8 to 14% your questions may be from mental health. And it says physical needs in the first line. Now psychological, valid physical need will take over psychosocial needs. So very important that you know psychosocial needs. Highlight the word psychosocial means mental health. And psychological needs. So when they're saying physical need, you're looking more other needs, comfort, rest, medication. Psychosocial needs are your mental health. Leave that whole paragraph, move into the second line, manic patient. So when they give you a question, manic patients are mania or manic. Manic people or severe anxiety people, they both are a little bit similar. But manic patients are, or they are in manic patient, what do you need to look for your patient? When the word comes manic and severe anxiety, and when they have severe anxiety, they also are very hyper. The meaning is both, they're very hyper patients are. And when they're hyper, they cannot think correctly. Remember that. And then underline the word food and fluids. Very important. The first priority you give, your patient has manic action, or patient has severe anxiety level. Remember, because they're so restless that they need your food. So number one, your food is important. And what is in the food is, you pick up the answer, their needs, high metabolic needs. They're burning their calories because they're manic. They're severe anxiety. So what do you need to increase here? Is write down on the top, protein. Increase their protein. Increase their calories. So when you have food, write down increase calories and increase protein. Maybe some question, they have give them milkshake. Are we clear? So they can drink and they have a milkshake, maybe a better food out of other foods are. So something you can give them and they can receive more energy. And underline, so very important, patient has a manic depressive, patient is in mania, bipolar patients are, and also same thing with bipolar patients, they are very manic. And you got to give them food. Then second thing, underline the word safety. Safe environment. Write down the answer. Your answer would be safe. See, these are the wording. So, and provide safe environment, safety. Avoid cluttering in the room. No cluttering, so they can walk around and they're safe. And also supervise them. Low stimulation. What is low stimulation? Quiet room. So quiet room and safety is very important. Need limits on things like exercise. They're already hyper, so don't let them exercise. Limit their exercise. They're already constant in motion. So when we are saying patients who are hyper or patients who are manic, always remember you need to cut down their activities because they're already manic. What is very important, their food, because they're not eating. So increase their calories, increase their food, and also supervise them. And when you are supervising, they need limit on the things, and they're like exercise and constant motion, because they're in constant motion. So that covers you a question with manic patients. Cover the question severe anxiety. They need supervision. Next is lithium. We said lithium you give them for bipolar patient. Write down there. And lithium is, you will go in the bottom of the page on the same side, and it says lithium cause diuresis and like diabetes insipidus. So you need to increase fluid, keep hydrated. So keep moving in the bottom of the page on the same side. And the last line, it says lithium. Keep moving on that page. And in the last line in the page, it says lithium cause diuresis. Are we clear? Did you get it? And also, so make sure you make arrow and write down when you have a lithium, you got to increase water because they are peeing more, like a polyuria. And increase salt, write down the word salt. So in your question, when they give you what is lithium is, you all know what is lithium is, bipolar medication. What do you increase for lithium are fluid and the salt. Are we clear? So that's important. And don't give any more diuretics with them. If you're giving any diuretics, they will pee more and they can go in toxicity. Now let's go back on the top after lithium. So lithium we already talked. Everyone should know lithium is a bipolar medication and you're giving fluids. I will go back on therapeutic communication. In mental health, even your med-surg question, whenever you're talking to your patient, you should use what? Therapeutic communication. A specific technique, a specific side problem. They have a mental health. You're not going to argue with them, but you're going to show the right way and right thing. So your communication should be very therapeutic to help them in the treatment. Are we clear? So all your treatment work comes, how do you communicate your patient? Therapeutic communication, whether it's a med-surg or what. Alcohol withdrawal question comes in exam. Alcohol withdrawal is they're going into DTs, delirium, and also what is treatment depend, no alcohol patient are, is when was the last drink patient has. And also for your alcohol withdrawal patient, they're going to have seizure. They're going to have is confusion. And also you remember what are the medications I told you for alcohol withdrawal patients are. I want you to write down the word Librium and Ativan. And you can give right away when your patient comes with alcohol withdrawal. And antabuse, you can only give, write down these three things, when your patient is free of alcohol for 12 hours before and after 14 days. So write down like that. So this is your first drug. If they give you a question, patient is admitted. So what I'm telling you, wherever you guys are reading, alcohol withdrawal question you will see. And what kind of room you're going to put your patient with alcohol withdrawal? Quiet. So Librium and Ativan and antabuse. You cannot give antabuse unless your patient is free of alcohol for 12 hours. And after you give the treatment, 14 days they cannot drink. Are we clear? So patient asks you, how long antabuse in my body is? So you will tell them is about 14 days antabuse in your system. So we got to know about alcohol withdrawal. Quiet room, monitor for seizure. They can also go in seizure with alcohol withdrawal. OCD, obsessive compulsive disorder, is anxiety. And what is the word is called when you are not really mental? I want you to write down the word is neurosis. Whenever you see the word neurosis, they are nervous people. Are we clear? So it's a nervousness, OCD. And O means obsessive and compulsive disorder. Write down the word obsession is a thought. What is OCD means is obsession is a thought. Compulsion is a action. So you got to know they are obsessive means in their mind. So write down the word obsession. Obsession is a thought. And compulsion is action. So in your patient mind is coming, my hands are dirty. And what action they're doing? Washing their hands. So remember, obsession is a thought. You are obsessed in your mind. My hands are dirty. And what are they doing? They're washing their hands. So if they give you a question, never tell your patient to stop washing your hands right away. How do you handle them, OCD patients? Number one, allow them to do the ritual. Don't stop right away. Your first answer, allow ritual. Now, I'm telling you, you guys need to definitely know how you're dealing with your patient. So if your patient is there, don't go and tell them, don't wash your hand. They will become more anxiety. So what do? Allow ritual. Second thing, safety, very important. Monitor for safety. And number 3 is involve them and move them or involved in other activities. Make a plan involved in other activities. So remember, you allow them the rituals. First thing, monitor for safety. Number 3 is involve them in other activities. Maybe we are having a play 10 o'clock. We are watching movies. Let's get out and go for movie. 2 o'clock, we have another program. At 1 o'clock, we have a lunch time or we have another party. So you are taking them out. And also write down number 4 is a schedule. And always for mental health, any patient, written schedule. What time they can stay in the room, what time they should be out. So these 4 answers are very important. So OCD is what? Is not a psychosis, it's a neurosis. What is a neurosis word is the nervousness. So don't go and make them more nervous. And there may be a reason for their anxiety. Maybe find out the reason for their anxiety, and that can help them to relax them. So found the reason for their anxiety. Next is, I will move on, side effect of psych medication. Now, do you guys remember? It's very important when you're giving psych medication is such as Haldol, Thorazine. A lot of drugs are your psychotic medications are. Side effect, you guys have done EPS and neuroleptic malignant syndrome. Write down 2, very important. Wherever you have written, make sure you memorize because you're going to see somehow in your question. And what happened in EPS is extra, we call pyramidal symptom, extrapyramidal symptom. And the meaning is what happened in extrapyramidal symptom are, they are involuntary movement, number 1. And they're tapping their foot. They cannot sit down quietly. And they become stiff. And they're drooling. Now, they may give you the wording, some wording, and you guys have written earlier, but EPS is extrapyramidal symptom. I'm on page number 13, where we says is after OCD psych medication. We all should know 2 side effects which comes in exam are extrapyramidal symptom and neuroleptic malignant syndrome. What happened neuroleptic malignant syndrome? Patients start fever. That's very important. Hyperthermia. They may use the word hyperthermia. They have high fever. Number 2, they're drooling. And number 3, the blood pressure is fluctuating. So they're drooling, fluctuating, and number 4, they start becoming very stiff. Now what do you do on this question here? And they might throw the question. Your patient is taking antipsychotic medication and your patient has neuroleptic malignant syndrome. What do you do? Now, don't call the doctor. They're looking for your answer. Stop the medication or do not give your medication. That means you're not giving medication if you see the symptom. Number 2, lower their temperature. Number 3, fluids. You can give them fluids. And check the blood pressure and the vital sign. Then number 4, you can call the doctor. Now, everyone remember, whenever you're giving psychotic medication, such as Haldol, Prolaxin, Thorazine, those drugs are your psychotic. And when we are giving to our patients, patient has a lot of psychotic side effects. So I have done, you guys have written in other packages, we have talked in the Spider-Man, but very important is you must know these 2 wording, EPS. How do you control EPS? I want you to write down the drugs they give it to control EPS. Is cogentin, Artane, and Benadryl. So write down cogentin, Artane, and Benadryl. those 3 drugs can be given side by side with your medication, so patient will not have EPS side effect. So if they give you patient, what is Cogentin is? Actually, Cogentin is your Parkinson medication and you're giving for EPS, both. It came in exam. For Cogentin is for your Parkinson medication. And what happened? These patients start shaking. So you are stopping their EPS. So you got to, if you're memorizing is what is written here, will not be enough. We got to know more information. All right? So what is more information we got to know is about this is psychotropic medication. So everyone should know is psychotropic medications are EPS and MS, neuroleptic malignant syndrome. She will need the package. And so write down all psych medication side effect are. In most cases, I don't think so she has a package. Belligerent, agitated, patient cannot reason. Underline the word belligerent. Belligerent, go on page number 13. I don't think so you have that package, so let's go on page number 13. And belligerent means agitated. In the next line, in case belligerent, agitated, patient cannot reason. So if your patient is becoming belligerent, they didn't give you agitated, then what do? You cannot reason them. You cannot talk to them. Take them in a quiet room. Don't tell them even to go to your room. Walk with them. Are we clear? So if you say you go in your room, they're not going to reason. They're not going to understand. Let's go to your room. So what are you doing? You're taking away and you're keeping them in a safe environment. Underline that word. And the problem patient is removed from common area. Underline the word problem patient. Patient is shouting. Patient is creating a problem in the hallway. You don't want everyone to watch it, so take them in a quiet room. We do not ask them, you need to resolve around the uncooperative patient. So you cannot reason if someone is uncooperative. And so always take them alone, take them in the separate room and stay with your patient. Next is anxiety. So review anxiety in your book. I want you to go over a little bit anxiety. Now, do you think anxiety, do we have anxiety, all of us? Yes. Anxiety is normal. Everyone remember, when you have mild, there is a mild anxiety, there's a moderate, and there is a severe. Severe anxiety is very bad. If they give you a question, patient has severe anxiety, it's not good, because severe anxiety, you cannot reason, no reasoning. No reasoning and no understanding. They cannot follow you, they cannot understand you. Stay with your patient in severe anxiety. Stay with patient and they will need anxiety medication. So, severe anxiety. What is severe anxiety? Affects your vital sign. Are we clear? So, it's affecting your vital sign, your blood pressure. Maybe they start feeling chest pain and they might say, I'm going crazy. Word. That's a severe anxiety. Are we clear? So sometimes anxiety, we all have anxiety. I have anxiety, you have anxiety. If you don't have any anxiety, remember, mild anxiety help you to improve yourself. If you have anxiety and you study for your test because you want to pass, what are you going to achieve goals? So mild anxiety, you will achieve goals. Remember. And learning, you can learn. People who are careless, people who don't care, have no anxiety, they're not studying. They think they can pass the test. So what happened? They may not pass the test. So mild anxiety, increase your learning. Mild anxiety, improve your goals. So we all have anxiety. And their anxiety, your routine anxiety. We all have a routine in the house. And we have to go to work. We have to work with our children. And what are we causing? Anxiety. I have to drop him in school, and I have to drop this child here and there. So remember, it causes anxiety. So very important that we are talking about anxiety. and anxiety level is mild is good. If you don't have anxiety, you have no goals in life. What happened? I want to be perfectionist, I want to pass, I want to do good job, I'm going to take care of my kids. Aren't we going to get anxiety? We all have anxiety. I have anxiety. And what happened? When you don't have anxiety, you don't care about it. But mild anxiety is okay in your question. When they're saying moderate anxiety, here also learning is low. So in your question, anxiety, always remember, is comprehension decreases. If you're sitting with severe anxiety, whatever I'm talking you won't understand because your anxiety level is not able to comprehend. So we are having a patient. How do you reduce anxiety for your patients? How do you reduce anxiety for your patients in your question? How do you? We all have learned explain, right? Are you going to give injection? You just don't walk in with the injection and go and give injection. What will happen? Patient is scared. You take a big Hoyer lift and tell them, I'm going to weigh without telling, what is this big Hoyer lift? Poor patient who's laying in a bed and say, I don't know, what are they going to do? I go to hospital, I get scared with a lot of things when I see there, unless somebody tells me. So in your question, how do you reduce anxiety for your patient? By explaining the procedure, by talking to your patient. Which patient who's going for surgery? You're going to do any procedure. What are you going to do before you give Foley catheter in? You got to explain your patient, I'm going to clean you, I'm going to do this, we are putting a That is why first thing we say, talk to your patient. Communicate your patient. You bring in new admission, you don't tell him anything. What happened? Patient laying in a bed, they get anxiety. Everyone in a question. How do you reduce anxiety in your patient? By talking, simple answer, communication, and explaining everything before you do it, before surgery, before anything you're going to do, you explain them. What happens if they give you a question, patient has severe anxiety? What do? You stay with your patient, number one, because they're severe level. Don't call the doctor first thing. Don't leave your patient. Every time in these packages, your first answer, do not leave your patient alone. Are we clear? So what do? Stay with your patient. Number two, give anxiety medication and also monitor their vital sign. Are we clear? And so anxiety level, help them to release their anxiety, the safety for your patient. So that covers up OCD. Remember, in my mental health, if you guys are taking exam, if you can go back in my lectures and mental health, but I'm already specifying whatever I have said there, I'm integrating here, so even you don't get chance, you know how to answer OCD question, how to answer anxiety question. Are we clear? And I already said manic patient. What do you do if you have a manic patients are there, or severe anxiety? Now, next thing is depression. Your patient is, we monitor our patients for depression. Half of our population, if you're working in a nursing home patients are very depressed. They left home, older age, leaving children, leaving grandkids, and living in a nursing home. Do you think they're not depressed? We have a lot of patients in nursing home with depression medication. And also depression medication is assess depressed patient. How? Sleep. Somebody is not sleeping. You get up in the middle of the night and you can't fall asleep. Maybe person is very depressed. They're thinking about something. Appetite. Patient refuse to eat every day. Sign of depression. Patient concentration. They cannot concentrate and refuse to get up from the bed. Write down, laying in a bed. They don't want to get up. They don't want to associate with person. Energy level and interest. They are alone. Write down the word alone. Maybe the room is dark. They want to stay by themselves. And write down the next thing, weight loss. In your question with depression is, may not be all the time is you're looking for suicidal. Maybe your question, what do you monitor for depression? Their diet, their food, and they lost a lot of clothes. Patient blouse or the top is so loose. What does it mean? Sign that patient has been losing weight. Encourage them to eat, encourage them to be out, and depression medication. Everyone remember your depression medications are, we talked about Maui, are we clear? And everyone remember Maui medication goes in depression, SSRI, and tricyclic. So whenever you see this word, these are depression medication. Maui, SSRI, selective serotonin reuptake medication, and tricyclic group. Very important, your medication, depression, and when you're giving depression medication, it takes about 3 to 4 weeks to work, long time. Patient says, I'm not feeling better. Now, that means they are very depressed. Number 2 is their risk for suicidal. Whenever you give medication for depression, they have energy and they get so better. And they might say, what do you monitor? They're energetic and monitor for suicidal. I had a patient who was in my nursing home and he was discharged. He only stayed with us one day. And he became so good when he was treated in Arrowhead in a mental health. And he came and he didn't want to stay in nursing home. He wanted to go home. And doctor discharged him. When he went home, he took all the pills he had home and he killed himself. And it's not the pills what we gave, but he had, you know how when you take your medication, a lot of time you have not finished. You in the home, he has so many different pills that he took all of them and he killed himself. So he went home Saturday, Sunday he killed himself. So depression, you look good, you look very happy, but then your depression inner is taking you towards suicidal. So what do you monitor when your patient is depressed and you're treating them for suicidal? All your depression patients are. In your question, patient who's coming in the hospital, and in your question, you are admitting a patient with depression, and patient stated, I'm not eating, I'm not taking my depression medication, and I'm here. So what do you do the first thing? Check their belongings. Very important. May not be immediately you call the doctor, give medication, your first answer. What is in their bag are? Maybe they brought all their pills. Maybe they have a knife. They may be in a planning killing themselves. So patient, all your patients, do you have a legal rights to look through what patient brought in? Yes. Everyone remember that wording. Patient comes in, they bring the bag of clothes, bag of medication. As a nurse, you have to do their clothing and belonging list. Because so you know what patient brought in. Are we clear? So you do have a right, if they give you a question, patient has a bag and patient has a purse. What would you do? Search. Check them. What do they have in their belongings? Maybe they're planning to kill themselves and they're here. Check that. Then you go stay with your patient or monitor for suicidal. Then you go for call the doctor. Then you go for medication. Are we clear? So see how you got to go all that above answer? All the above answer you cannot memorize. You go and look what is matching with your patient with the diagnosis and you pick up the answer. So what do you do when your patient comes in with depression right away? Safety. What are you going to provide? Safe environment. In your, write down these wording. In your tray, plastic cutlery, plastic ware, not the real knife, not the real fork. Give them the plastic thing because you don't want them. Make sure the windows are safe. Make sure all the room, always check them. They have no knife, they have no blades, they can cut themselves. They don't have any rope, they can kill themselves. I had a patient who was collecting the plastic bag, big plastic bag, and in her room, and nobody paid. She had like 3 or 4 plastic bags, and what she wanted to do, put over on her the plastic bag and suffocate herself. And so people have no clue. They have depression, and what are they looking? They're tired of the world, they want to kill themselves. Everybody remember these few answers. Ask them what is their plan for killing also in your question. So those are answering your depression question. I'll tell you, whether you're working in a home or in a nursing home, you don't have to work to know mental health in a mental hospital. Our population, 80 to 90% have mental diagnosis. When I used to admit patients in nursing home, And one diagnosis, hip surgery. Second diagnosis, bipolar. Another patient I will take for liver problem, alcoholism. Are we clear? So every single patient, a lot of time you think, are you dealing in a mental health or you're dealing med-surg? There's no med-surg. Our mostly patient has diagnosis, lot of mental health, bipolar, anxiety, severe anxiety, schizophrenia, common diagnosis. Half of your patients are taking psychotropic. That is why in the NCLEX, your mental health is important. You must know the wording, manic word, anxiety word, depression word, OCD word. These are in your question, you might see. So everyone, I already gave you enough. It's important, on next line, underline the word trust. In your question, med-surg or mental health, what do you establish with your patient is the trust. And you establish trust before you begin to work. So before even you start working and you are first time you're going and seeing patient, you must show them that you are interested, you care about them, you love them, and what are you doing here is you support them. And what is first thing is, establish trust. Write down the word establish. You got to establish trust. If you don't establish trust, 90% patients are going to have a lawsuit against you. Why? Because they don't trust your judgment. They don't trust you what you're doing. Are we clear? You walk in, even simple question they're asking you, and you don't show any interest in a patient. Patient is not going to trust you. You got to show you care about them. Listen to them carefully. Whether you are working in a home, you're working in a hospital, or you're working anywhere, what is it important here is establishing the trust. Are we clear? So we got to establish the trust. Same package, page number 13. And a trust is important. And trust before you can begin to work effectively with them. Especially important with your depressed patient, therapeutic, sit down and hush up and listen. Underline the word listening. Hush up means don't keep on telling your problem to your patient. Listen to them. Don't say, oh, I'm here and I'm very busy and I'll come back in 10 minutes and you're gone and you never came back in 1 hour. What did you do? You showed impression, but you didn't even follow through. Don't go and tell patient, I'm too busy, I'm here. And you listen to them and create is confidence that you do care. And if you do promise something, you go back and do something for your patient. If you're not going back and you're not going to do, what are you going to lose here is your trust with your patient. So not only mental health, all your med-surg question, always remember establishing a trust is important. Yes, schizophrenic patient, bipolar patient, yes, you got to have a trust with them. Next line, psych needs classification, never just DC and SSRI. That's a depression medication. All your medication don't stop all of a sudden because they can go back in depression. And so underline the word and say slowly, tapered it. And always it will be good you monitor their behavior. Understand is serotonin, underline the word, serotonin reuptake are for depression medicine. I wrote it down SSRI. That's a selective serotonin reuptake. So write down there SSRI. These are called selective serotonin reuptake medication. These are your depression medications. So if they give you the word your patient is taking serotonin and SSRI, that's a depression medication. Understand sometimes is also spend the time actually learning, and you will carry that information beyond the NCLEX exam and practice as LVM. What they're saying, when you're giving medication, we all need to know the side effect, need to know how you give your medication. Medication questions are in NCLEX is important, and especially your mental health, antipsychotic medication. We all should know bipolar medication, depression medication, or anxiety medication. So 3 categories are there. Lithium, we already talked about it, underlined for bipolar. And what do you increase? Fluid, because they pee more and is more like a diuretics, and hydrate, and write down the word here, and salt. Make sure you let them take enough salt. So what is in your teaching when you're giving lithium is your fluid and salt, normal intake of salt, because they can dehydrate, they can lose a lot of fluid. And so two things, and lithium is a bipolar medication. So please write it down. And we will be talking about lithium level in some pages, and you must know the lithium level and toxicity of lithium. Delusion and hallucination. I want you to write down on delusion is what? False perception. Delusion, something is not true, and you believe that is true. Are we clear? So delusion is false perception. If you go on number 14 on the other side, and underline the second line is hallucination. What is hallucination? It's also write down the word sensory perception. Sensory perception means hearing. They hear voice and no one is talking to them. Their taste, touch, and smell. Someone is touching. Someone is grabbing them. And a smell. They're smelling a smoke. Somebody is going to kill them. Are we clear? So hallucination and delusion both are, I will say hallucination and delusion are psychotic. Psychotic, or another word is psychosis. It's a psychosis and psychotic. So when your patient has word hallucination and delusion, they're really a mental problem, not anxiety. What do they have? They have is psychosis. And they didn't give you a word hallucination. They said your patient is admitted with psychosis. What are you monitoring? You're monitoring delusion and hallucination. What is delusion? Which is not true. The clock is there and person sees that clock is a snake. That's a delusion. My husband is cheating other person. He's not cheating, but that's a false perception. But what is hallucination would be sensory. Someone is telling me to kill somebody. Somebody, I'm hearing someone is talking in the next room. No patient is in the next room and they're planning to kill me. I'm smelling the smoke. I think I'm going to die. Are we clear? So they are not true. So everyone psychotic and your schizophrenia and bipolar. Write down on the top. Whenever they give you a question, bipolar and also schizophrenia, I'm going to talk about in the next line, but write down on the top. So when you see schizophrenia and bipolar, they really are psychosis. Are we clear? And they have is delusion and hallucination. Next line in schizophrenic patients are, what is in schizophrenia is they are psychotic and they have hallucination and delusion. And we have talked about schizophrenia is either they are mute, write down the word mute, and also they are more like a waxy flexibility. Waxy flexibility means they're lame, no motion, and they're not moving, or maybe they're hyper, and their thinking process is affected. They're not doing their ADLs. Are we clear? Apraxia, movement. They're doing copy somebody's movement. So there are wording. When I have done the other pages and I wrote it down, a lot of things on schizophrenia, and they give in the exam. So remember, schizophrenic patients are not normal. They make a word salad. They're talking the words, and it doesn't make sense, and they call the word salad. And they're not really can make decision. They create a new word, neologism word. They create a new word. That means they're schizophrenic. They're not doing ADLs. So what do you do when you admit a schizophrenic patients? I'm just giving you a little bit input here. Is number one, keep them alone. Don't put them with other patients. They need a separate. They're not safe. They don't trust anybody. And number two, establish the trust. They are not trusting anybody. They think this world is very unsafe. Create the trust with them. Are we clear? ADLs. You give them ADLs. Are we clear? And give them their food and they will need the medication. Safety is very important for schizophrenic patients are. And so remember, schizophrenia, these are your diagnoses you're going to see in the exam. And those who have my mental health pages, make sure you read through. And I know some of you have done with my previous lectures, and I gave you a lot of wording, but schizophrenia and bipolar are psychosis. Are we clear? You never put them, never take them in activities with other people because they're not safe. Once they start getting better, you put them one-on-one. That would be better, but do not put them in a group therapy. And feeding is important. They're not real. Do not argue with them. But also remember, when someone is saying hallucination, I'm hearing somebody is talking about me. And they will ask you, how would you answer? Always say, I don't hear anybody because there's no one in the room. You're not going to say, yes, I'm also hearing someone is talking in the room. You got to not making person happy, but their answer would be in real world, be honest to your patient. Are we clear? So what is honesty? There's nobody in the room. You may be hearing and you may need some help. We do have people who hear that. That means is what? You need some treatment. So in a nicer way, you're saying, I don't hear. And a lot of people are persecution team in schizophrenia. Someone is coming to get me. Someone is going to kill me. So you're going to tell me, I don't see anyone, I don't hear, and they will say, did you hear the phone call? They're calling and the police is after me and they're coming to get me. And you can say, no, nobody called here, no one I heard, but we are with you, we are here, so we are watching you. Are we clear? So these are not normal patients. So for your exam, if you're taking an exam, I have discussed in first pages a lot of wording for NCLEX. Even you don't go my package, if you will read these packages and whatever you added, I'm telling you, you guys need to know the wording. Schizophrenia is your psychosis. The next line, antipsychotic medication. We already talked about side effect of antipsychotic medications what are those medications side effect are? EPS and neuroleptic malignant syndrome. I talked earlier, if you came late, so just write down on the top, EPS, extrapyramidal symptom. Pyramidal symptom. What do they do? Involuntary movement. They're shaking. Now you're giving Haldol and Thorazine and your patient is becoming like Parkinson. They start shaking. That is your EPS. They become very stiff. And they're tapping their foot. They cannot stay quiet. And they're drooling. Very important is, and what drug do you give them? I already said Cogentin, Ativan, and Benadryl. You can give these three drugs to help to control EPS. Second is neuroleptic malignant syndrome. We had in a Spider-Man also. And I have discussed that in the Spider-Man. So everyone, neuroleptic malignant syndrome means they start fever and they're drooling and their blood pressure goes very high. Here, first thing you stop the medication. Don't call the doctor and they might give you, your patient has neuroleptic malignant syndrome, what do? You stop the medication. So make sure you all know your question, antipsychotic, schizophrenia, bipolar medication, lithium for NCLEX. Rehab are master manipulators. Remember, psych, we use rules and limit setting. Underline the word setting, limit setting, to prevent manipulation. Now, what are the problem with your patients are? They're manipulating. So when they're getting better, manipulating. And you get that patient and you're taking care. So what do? Very important answer, set the limit. All your patient, when you admit them, or patient who's getting better, especially mental health, they understand, set limit. Even schizophrenia patient, this is a good answer. Patient must know what can they do and what they cannot do. Are we clear? Because what happened? They're very manipulative. And if you leave them and let them continue, you will have a big problem. So you got to stop from the beginning. When your patient comes in, they got to know. And if you see they're alcoholic, I had alcoholic patients and very smart, They buy all the bottles, they hide it in the closet, and they drink. We check every morning. We check every shift. Nurses find out the bottle, they bring it to my office, and I will talk to that patient, and I'll say, you cannot keep them here. You're not allowed to keep. If you continue, and if I find it next time, I will ask you to make your arrangement. I will not allow you to stay here. So you got to let them know what can they do, what they cannot do. You have a patient who's a smoker, and he goes in the room, in the bathroom, and smoking. Are you going to allow them to smoke? You're going to burn the building in one day. So you got to stop the patient. And I'll tell you, I have patients who sell their pills to other people. You give the pills, and they put in the mouth, they take it out, and they dry it up, and they're selling other patients. You don't know what goes on with patient's mind. Your job should be done as you have learned. Give your medication. Make sure they swallow the pills. I had one time a CNA who brought me from patient's room 1 cup of pills, all different colors. That patient hasn't been taking the pill. Very manipulative, talkative. Oh, just leave it, I'm good and I'll take my pills. And the nurses are very naively leave those pills with them. Even you trust a patient. No, that's not your job. What is your job? Make sure they swallow the pills. So this patient was going out of hand. He was a mental patient also. He was admitted with a bipolar, and he has not been taking his medication. So very important that you got to set the limit. You got to let them know you cannot do this. And very important, all your patients, you must have set the limits. Violent patients are threatening. Only patient don't stay with. If your patient is violent, write down safety for you. Number 1, you must have somebody with you when you're approaching them. You don't want to get hurt from a violent patient. Who can also put them isolation, or you put them in seclusion word. I want you to write down the word seclusion. They give in the exam, seclusion means putting isolation. If your patient is violent and you have to do seclusion, who can do the seclusion order without the doctors, your supervisor, your RN? Only RN. Are we clear? No other person make a decision to keep them in a safer room, put them alone in the room. Are we clear? And always before you attack, your patient is becoming very aggressive. Patient is very violent. Why are you going alone? You got to have somebody who can hold that patient, and you may have problem. Can you put a restraint a patient who is really dangerous to self and others? Yes. And also is involuntary admission. In your question, what is involuntary admission means? Without patient's will. Involuntary. If they give you what is involuntary admission, is without patient will. Which patient are you going to force to take him to the mental health? Who is danger to self and others? Are you going to have his permission to go to the hospital? No. So if they say, what is involuntary admission? Patient who's not safe, you can admit them and they will never be discharged without the mental health doctor. Are we clear? They have to approve this patient is safe to go back in community. And if they let this patient go, that's their responsibility. But if you have gone involuntary admission and patient says, I think I'm okay, I don't need to be here and I'm going home. Can patient go home? No. Your answer would be only patient would be discharged by mental health doctor. Are we clear? So what are two admission comes in mental health? Involuntary and voluntary. Voluntary is okay, they're coming themselves and they're okay. Involuntary patient, you are calling 911 and you're calling police and they're escorting them to the hospital. Are we clear? Now a lot of time, if you have transportation and you call ambulance, and patient says, mental patient looks very good. And they will say, I am okay, they're crazy. They're just sending me to the hospital, I don't want to go. Ambulance will tell you, I cannot force this patient. Why? Because patient looks very sensible, patient is talking, and many times you will have a problem transferring the patient. Then the best thing is you call the police. and you have the patient witness something they're doing wrong. Because involuntary admission, you got to be taken forcefully. Are you going to allow that patient to hurt somebody else? No. So those patients are involuntary. Now, I took some time here because we haven't talked mental health. Very important that we all know mental health. We deal every day with your patient. And mental health, we got to know how to approach them, how to deal with them, and how you're going to document. So next is therapeutic communication. Some of the examples I hear for therapeutic communication. Response in feeling tone is good, and also is provide information. That's good. Patient is asking, do not ask why. That's never good answer in communication. Do not ask yes or no question. More explanation is good. Do not focus on the nurse. Do not explore and probe. Don't say, don't worry. That's an absolute wrong answer. Never say, don't worry, you're going to be all right. You don't know if they're going to be all right, but don't worry is not good. Everybody worries. Yes, it's good. I know you are concerned, and explain them, but don't use the word. So these are not good. Depression patients, we already talked about. First line, underline the word onset, peak, duration. You need to know. Therapeutic serum level. You're giving depressive medication, make sure check their blood level. Energy. Energy is common. Increase. And write down when the energy is increased, the risk for suicidal. And actively based therapy. Participate in activity and provide social life. Depressed patient, you need to involve them in some activities. Manic patient, second line, when they're manic, don't put them in a group therapy. Play with others. They're manic, they can't sit down, they cannot concentrate. And stay with them. Supervision. Manic patient is distract manic patient and toddler. Toddler is more, they're not really manic, but they're more you need to supervise. So manic is you need to, suicidal patient. Be direct, ask them what is their plan. Pain in psychosocial, but remember some pains are deadly. Now sometimes can be your pain psychosocial. So in your pain answer, always check the chest pain. If they have kidney pain, burn pain you can be, and always when you have is a different kinds of pain, always you're looking airway and write down the vital sign. Vital sign shows patient is in pain. So in your question, what do you assess in pain is rating of the pain, facial, and the vital sign. Make sure you choose your answer and get into what has happened to your patient. So we finished page number 13 and 14, and I will go on. Next page is page 11, health promotion. In health promotion is the page number 11, is we have talked some of the things. Second line, play, is the work for the childhood. So in your page number 11, you guys have, right? Did I finish? Oh, I'm going backward. We did 11, 13. I should be going on 14. So we finished that. And 14, 15. Page number 15. And any answer, choose that give additional data and assessment. Underline the word assessment. Underline the word volunteers. Question the patient, volunteer information. How do you assess your patient? Asking patient. Let the patient be, page number 15, volunteer information. Let the patient tell you what's going on with them. They are the best one to tell you what's wrong with your patient. And what do you do in the second line right now? What do you need to do something for your patient to relieve pain, relieve comfort, whatever you do, whatever you need right now. Then skip to line and then you go. With med question, you must know your generic and trade name and memorize them. That means the drugs are important. If you can memorize ending word, memorize. They do give both the generic and also is the trade, but they want you guys to know. Next is ABG. Now ABG, I'm going to talk here a little bit about ABG, and I will ask you, I gave some pages before and some of you have it, and if you don't, I will give it to you. And if someone needs these 2 pages on ABG, anybody, if you don't have, there are 2 pages I gave before. Most of you have, those who have been coming, is this page and acidosis and alkalosis. And I'm not going to go complete package, but I will ask you guys, because we have done completely, but I want you to provide. Now on this first page, it says what you guys have here. And what does it says here is acid-base, remember the word Rome, R-O-M-E. And what is respiratory? And it says here, respiratory, and O means opposite, M means metabolic, E means equal. Now, so it's, you guys have in your notes, keep this here, but let's concentrate on page 15. And it says respiratory, and I'll ask you to write down a few things there, so when you're memorizing, you will be good. So you already have the word Rome. What is respiratory opposite? So what is opposite here? In the third line, you guys have pH. And what is opposite between pH and CO2? So when you're looking in respiratory, metabolic, so in respiratory, you're looking metabolic acidosis or metabolic acidosis, and then you have is alkalosis. Are we clear? So we have acidosis word, and they're saying acidosis and alkalosis. So remember, when they're saying respiratory acidosis, respiratory alkalosis, this goes, your pH and CO2 is opposite. One is low and one is high. Are we clear? And so I want you, CO2 goes up and pH is down. So when we're talking in respiratory, is remember, one is low and one is down. And you guys have here on this page, so what happened in acidosis, I want you to add in your notes, pH is low. And what are we looking here is PCO2 is opposite. What is your normal pH? I want you guys write down there on your notes. So you don't need to go back, but if you're home and you're studying, you will know. So what is your normal pH is 7.35 to 7.45. That's your normal pH. Are we clear? So we are doing the package, and in that we are on page 15, and respiratory acidosis. So when you have acidosis, always remember your pH is low. PCO2 is high. So this is your normal pH, and what is your CO2 is 35 to 45. So whenever they're saying is MEQ, it goes in MEQ per liter. You guys can add on this page 15, so you don't need to go back. Everyone, when you're remembering, you remember respiratory is opposite. Are we clear? What is opposite? You got to see your CO2 level. And what you have to see here, your pH level. So it's opposite. So this is going to be low, and this is going to be high. In alkalosis, your pH is high, and PCO2 would be low. So when your patient has acidosis, your carbon dioxide is more. Everyone agree that? So what is high here? Your CO2. So what do you need to give your patient here when you have more CO2? Oxygen. Are we clear? So remember, write down one word. When do you have acidosis, your CO2 is high. When you have hypoventilation. Your question. See, you got to connect yourself. So your patient is hypoventilation, means is you need to give oxygen. Are we clear? And what is your patient is doing here is they're not getting oxygen. Maybe is effect of your drugs. Maybe after surgery, your patient, maybe patient has pneumonia, and your patient has what? Lack of oxygen. See, your questions are not all about acidosis. That's why I gave you these pages. And it says in these pages, and the first page, when you guys go home, hypoventilation. How do you get hypoventilation? Means you're not getting oxygen. Your central nervous system depressed by medication. Are we clear? So keep this aside, but on your pages. And simple way, I want you to remember in your NCLEX, the questions are going to be, your patient is hypoventilating. What are you going to look for? Respiratory problem. And what is patient is respiratory? Acidosis. Are we clear? What are you going to give here? Oxygen. Remember, what are they retaining? Their lungs are not opening. Their lungs are not opening. They're not able to get what? Oxygen. And are you going to give more pain pill, sleeping pill? No. Your first answer, cut down the drugs which are depressing. See, your questions are in NCLEX is not all about balancing this and that. They will give you a question, your patient is admitted and patient is hypoventilating and their CO2. What is your normal CO2? More than 45, 50 CO2. Your patient is having what? Acidosis. Are we clear? So I'm giving you simple thing and I'm giving you extra notes. I've done that and also a lot of in the Spider-Man. But if you write it down, everyone remember, what is hypoventilation? Hypoventilation, lungs are not opening, a patient is in what? Respiratory acidosis. Everyone is okay, all right? So what is respiratory acidosis? Means hypoventilating. What do you do to ventilate your lungs? And they're saying, what do you do for your patient who's hypoventilating? Turn them. Incentive spirometer, suction, oxygen, cough, deep breathing exercise. All what a nurse need to know, you are applying in your question. Are we clear? So everyone is okay. Hypoventilation is what? Respiratory acidosis. I want you to write down there is hyperventilation. Hyperventilating, what are you doing? Anxiety, when you have anxiety level. And what happened in here, hyperventilating is fever. Write down the word fever. When you have fever, anxiety, that can lead to hyperventilating. And remember, some question they give pulmonary embolism. Write down there. Half of your question, patient has pulmonary embolism. What are you assessing your patient is in this anxiety and also hyperventilating, fever, anxiety level. What is hyperventilating? What are you less here? Opposite. What is less here? PCO2. Are we clear? So what would you do now? You are losing what? Carbon dioxide. You are hyperventilating. So what do? Paper bag breathing. Write down, that is your answer. They give you a patient is admitted with respiratory hyperventilating. What do you give them? Paper bag. And also is breather bag. Are we clear? Is when you rebreather mask. So write down the word. Your answer would be rebreather mask. Rebreather mask. And you're using paper bag. Now, that covers your respiratory acidosis, alkalosis. And what do you remember here? Your pH level and what level? CO2. What is your normal CO2 would be 35 to 45. Any question? Somebody gives you, patient has this disease and their CO2 level goes high. What does it mean? You need to save CO2. Are we clear? And what is CO2 is going higher here in acidosis and you're losing here in alkalosis. Everyone remember, pulmonary embolism patient, a lot of question can be on your respiratory alkalosis because they are hyperventilating. Two words, hypoventilating and hyperventilating. One word, remember respiratory is opposite. What is opposite here? pH and CO2. I want you to go and look in your page number 15. It says metabolic. What are you looking in metabolic? Your pH. And what is second thing you're looking is bicarbonate. HCO3. Normal 22 to, I have in my notes also, but write down like that. 22 to 26. Now in metabolic, I will write down here, metabolic. Here is in metabolic, I will go, is alkalosis. In metabolic alkalosis, I want you to write down is pH. Everyone remember one thing, all your pH level is high in alkalosis. Are we clear? Both, whether it's a respiratory or metabolic. And what are you looking here? Bicarbonate. So alkalosis, they are equal. If your pH is high, your bicarbonate is already high. They're equal. Then if you're going in acidosis, what happened here? In acidosis, both thing is low. Your pH is low and your also bicarbonate is low. Very simple. Are we clear? So what is metabolic acidosis and alkalosis? Equal. What are you looking in equal? Bicarbonate, not CO2, bicarbonate. And they're going to throw the word patient's bicarbonate. And remember, all your alkalosis is high. So if your metabolic alkalosis pH is high, your bicarbonate is going to be high. In acidosis is going to be opposite. So I want you to write down like that and memorize and write it down, not only here, but you should add here. So you're not looking these 2 pages. And simple way you remember, what is your normal pH in the blood is 7.35 to 7.45. I said all your alkalosis pH is high, all your acidosis pH is low. Are we clear? And which are the patients are going to have your metabolic alkalosis? I want you to write down for metabolic alkalosis. What is the reason? And that comes a lot in your NCLEX question. Are we clear? So I want you to write down for metabolic alkalosis. Which patient do you monitor? So write down on the side. And I'm asking you to add there, if your patient is taking diuretics, you're losing potassium. Alkalosis, you're losing potassium. And so write down in alkalosis, diuretic. Vomiting, your patient is vomiting. Your patient has GI suction. This question comes in exam. Your patient is admitted and patient has GI suction continuously. What is your patient is losing here? Metabolic alkalosis. What do you monitor patient who is with G-tube with continuous suction? Alkalosis. What are you monitoring when you're giving diuretics? They can lose a lot of fluid and as well as sodium and potassium. They can go in there. And vomiting and GI suction. And also antacids. If you keep on taking a lot of antacids question, monitor patient for metabolic acidosis. Excessive of soda bicarb can lead to, I want you just write down, so in case you see in the exam, and also these are very important diuretics, vomiting. Your patients start vomiting, they can lead to metabolic alkalosis. Patient who is having a GI suction, they can lead into what? Metabolic alkalosis. So what is metabolic alkalosis is? All your alkalosis, your pH is high. All acidosis, your pH is low. Everyone is okay? And what is your normal O2? PO2 normal. In ABG, when you're doing O2, should be 80 to 100. Are we clear? So 80 to 100. So you guys remember all your acidosis, alkalosis. And one simple thing, remember, respiratory is opposite. And also, when you're going metabolic is equal. Are we clear? Everyone should know this. Everyone should, when you go home, I have the reason for why do you go in acidosis? Very important. Metabolic acidosis, your DKA patient. Diabetic patients, you monitor for, and patient who is renal failure. They're going in metabolic acidosis. Your patient who's having a heart attack, they're going in metabolic acidosis. So, few things we all know. Diabetic patient goes in, what patient has DKA, in the exam they ask, what are you monitoring? Your answer would be acidosis. Are we clear? Renal failure patients is going into what is metabolic acidosis. So I gave you these 2 information. You guys go through on that a little bit. But if you remember, in arterial blood gases, what are we doing here is ABG. ABG helps you for knowing your patient into acidosis and alkalosis, your CO2 level and oxygen level. And when your patient is having a breathing problem and you want to know their blood gases, you do ABG. What test do you do before ABG? What test do we do before ABG? Allen test. Make sure you guys write down the word Allen test in the exam. And see, you got to connect it. So I have done a little bit ABG. We'll take a break after this, then I will move on to the next. So everyone make sure if you don't have these two packages, he has it. And make sure we all know your patient hyperventilation is alkalosis. Hypoventilation is acidosis in breathing. Two words will solve your respiratory problem. Diabetic patients are going in acidosis. If you have suction, your patient, and vomiting, you're going to go in what? Metabolic acidosis. All right, so let's take a quick break, 10 minutes.